The National Education, Health and Allied Workers Union is calling on the government to widen its net and searching for more vaccine options. The union says the government should consider the Russian-made Sputnik vaccine and the Finlay Institute vaccine from the Republic of Cuba. For more on this, I'm joined by NEHAWU General Secretary Zola Saphetha. Zola, thanks so much for speaking to us. Do we have a potential crisis on our hands should we not get these two options that you suggest?
Good evening to you, Hugo, and the viewers. We are not necessarily suggesting that, but because we are a country that is in desperation, that needs support and also needs a form of intervention, and we do think that there are countries whom we have relations with through BRICS, and we think that we can quickly secure things to escape the long bureaucratic processes to be undertaken and taking an advantage of our relationship, but also countries that we have historic relations and we built some strong programs with, like Cuba, who are willing and have been forward to assist us in terms of the provision of the tried and tested vaccine, which takes into account of our own situation in the form of the new variant, the so-called South African variant. So that's what we say. We shouldn't be confining each other only to West. Let's look into other options elsewhere, using an advantage of our relationship that we have established with those different countries.
A few weeks ago, in fact, when the vaccine arrived, Dr. William Kiza said that we should all join hands and work together. Has this process been consultative, or have you engaged the relevant ministry regarding your thoughts and suggestions?
We have been engaging with the department. As we said last time, that is one area as opposed to the PPEs that we are engaged in, and we've been brought or invited to participate from the early stages of this process, the vaccine one. We've been part of the policy framework programs to be developed, and also the process of distribution. We have been participating, including the positioning now of what we had received from the 1st of February. So we've been participating and will continue to participate. One of the things that we will be placing when we meet again is an issue of Russia, for instance, because of our network as a union. We've been talking to our sister unions in Russia who have put pressure to government, who is currently willing to venture into discussion with South Africa. In fact, Russian government has been looking for South African government to engage with them so that we can secure this. And this vaccine in Cuba has been proven really to be dealing with 501 V2 that we are confronted with, which AstraZeneca cannot do. So it's precisely that point that we want to make with them as part of what can be done and what cannot be done. And equally, we welcome the Johnson & Johnson vaccine, and hopefully within the period that the minister has indicated, 4 weeks from now, we will be securing that and we start to roll out. So there's no crisis really, and we ask people not to panic, but of course they must be concerned, but not all is lost. We should be strengthening our ability to secure more so that we can save our nation.
I think it's easier said than done to ask people not to panic. One of the issues that has been talked about widespread, in fact, has been the securing of this vaccine, the AstraZeneca vaccine, which obviously now has amounted to naught. So there will be obviously a certain amount of pensiveness, if you will, certainly in the market and amongst your stakeholders.
That's correct. In fact, the most affected people are the frontline workers, because the announcement made yesterday did not only bring anxiety, but also disappointment. As you will recall that as NEHAWU, we have been speaking to healthcare workers in the period of December and January. We couldn't enjoy our holidays, begging and persuading them to be available and also to be recipients of the vaccine against their will. So we persuaded them when they were ready to be vaccinated. There's a bomb being dropped that this vaccine is not, it's 22%, it doesn't help. So therefore, they got disappointed. So we have to venture into another process now of persuading them because they've lost hope. So We know that, but for the purpose of giving hope, we must always communicate a positive message despite the difficulties, because really not all is lost. And there are promises, and also we are not only relying to government, rather we are reinforcing the efforts of government to ensure that using our own relationship to secure a reliable vaccine that can take us out of this crisis.
Now, you did mention in a statement you issued that you appreciate the transparency from the Department of Health. What are the sort of timelines that we're expecting for this new vaccine to arrive? And what is the ensuing rollout for the members that you represent?
The minister had indicated that they are expecting between 1 to 4 weeks from yesterday. And I'm sure we'll be convening sometime this week to get into details of the preparation of receiving. But our call is that South Africa, while waiting for the Johnson & Johnson, must put all processes, including testing, so that we are not getting surprised again once we receive this. Our view is that once we receive this vaccine, we must roll out, because all systems have been put in place. Just as a matter of taking them, transport them to a laboratory where we'll be testing the accuracy of the vaccine, and then roll out, because people have been mobilized, and they've been even not only mobilized human, but also psychologically, they've been looking forward to this vaccine. So it don't have to take long, really, but we ought to go into the discussion and look into the plans, strengthen where the plans are weak, so that we don't disappoint again.
Now, the one thing that has been talked about is the tests that will be conducted, the tests that are conducted when the vaccine gets here. Now, obviously, as recipients of the first doses of the vaccine, are you involved in that process, and are you satisfied?
We are all public sector, all health sector unions are part of the committees that are established by both the minister and the director general. We are afforded an opportunity to contribute also, not only at the level of discussing, but also on the policy development and the programs themselves. So we do express our views, and the space is there for us to be expressing our views, and then also to influence the direction, because we are concrete people. We don't draw things from theory alone. We balance what we are raising with what we are experiencing on the ground. So what we always suggest and contribute is a solid view, because it's a balance of theory and practice, and that is a concrete way of contributing. So we're given in the space. That's why even ourselves, we are going to drag our government into the negotiations with Russia, having been facilitated by us, so that they will speed the process of securing the vaccine, and then people, South Africans, can be vaccinated.
Now, one of the challenges you're most likely to have stems from certainly what the president said, and that nobody will be forced to take the vaccine. Has this proved a challenge for you amongst your stakeholders in convincing them to take the vaccine?
Certainly, because health experts themselves have communicated many different messages. In some instances, our members believed that if you take a vaccine, it's possible that you can be transformed into a baboon. And those are the things that time to time we interact and also speak to them, because the critical challenge for South Africans is a lack of an accurate educational awareness program that takes South Africans together. For instance, it became a shock from the yesterday announcement, because there's never been an explanation of the new variant, what it means. Okay, but what we know, we're told that the second wave virus, not necessarily speaking to the new variant and its complication, can make you to be sick and will be severely ill, and also you can also die. It has never been spoken about. As a result, most of the people, they don't know what kind of an animal that we're talking about. At worst now is a vaccine, and there has been a distortion, because to a point that members, they are told that the vaccine is of a prevention of some sort. Others, they are told that is a chore. Yet the vaccine is nothing else but to prepare your soldiers to fight any kind of a virus that will come to you, so that you don't get sick, get severe ill, or be confronted with potential death and so forth, but you can live and you have a mild kind of a responses to it and so forth. But to be presented as if is a solution to all our problems is not correct. So that's why we say we must, together with government, venture into a program that teaches our people, not only healthcare workers, but society as a whole, about this new variant. And it's not late to do so, but also to speak the truth about the impact of a vaccine amidst the global crisis that we're confronted with in the form of a coronavirus.
Zola, always great to speak to you. That was NEHAWU General Secretary Zola Saphetha.